Welcome to the Putnam County Library Lunch and Learn series. Today we are joined by Matt Silvey, who will be talking about addiction, prevention, recovery, and community resources. Take it away, Matt.
All right, you ready to go? Okay, so I'm Matt Silvey. I am the support coordinator with the Tennessee Tech Center for Addiction Prevention and Support. I'll talk a little bit more about our center and the way that we try to intervene and get involved in the prevention and recovery community a little bit more towards the end. But the focus of this talk is not just obviously about us and what we do at the center, but to really provide a brief overview of why we do what we do. Okay, so we'll go ahead and get started here. In the beginning, we probably need to define some terms. Okay, now when it comes to what is a drug, what is drug abuse, what is substance misuse, these are things that may vary depending on the setting that you're in. If you're in the medical setting, then you're going to have a very specific definition of what those things are, and so they may vary depending on where you are and certainly vary across cultures. But for our purposes, we're going to use these right here. We're going to identify a drug as any habit-forming substance that directly affects the brain and the nervous system, okay? And drug abuse, which more and more often is just being referred to as substance misuse. In modern parlance, regular or excessive use of a drug when, as identified by a group, as the consequences endanger relationships with other people, are detrimental to the user's health, or jeopardize society itself. So when we're talking about what is use versus misuse, we really take into account the context. So it's not just the presence of the drug, but we're going to look very closely at what is the effect of that use on someone's life, whether it's causing negative consequences, if the use persists despite these negative consequences, and then we'll sort of move out from there, the consequences all the way out to sort of the general public health and then even global health. All right, so addiction, let's define that one. Again, similar to what I mentioned earlier, it really depends on the setting that you're in. We'll use these terms, addiction and chemical dependency. Again, these are most commonly used in the medical model, the disease model, but that's what we're most familiar with, and so that's what we'll use today. Addiction, a compulsion towards some specific behavior. Now that behavior may or may not be substance related. As we know, there can be other behavioral addictions. Think about gambling and other behavioral addictions. But a compulsion towards a specific behavior, such as the use of alcohol or other drugs, despite negative consequences, and psychological or physical dependence on the behavior or the substance being used. Not everybody realizes that we can become physically addicted to a behavior, but we can. We'll talk a little bit about how that could happen. We won't get too deep into the weeds. There are many other experts out there that could do a better job than me at that. And then when we're thinking about chemical dependency, this is something that comes up. It's sometimes used interchangeably with addiction. But when we're talking about chemical dependency, we're talking specifically about addiction to alcohol and or other drugs, as opposed to those non-chemical addictions such as gambling and other types of behaviors. Just to present some basic facts here, in 2022, we know that 70.3 million people age 12 or older used illicit drugs in the past year. Tobacco continues to wreak havoc in our culture, killing almost 500,000 people a year. There are close to 90,000 alcohol-related deaths per year in the United States. And so it doesn't take a deep dive to see very clearly the impact that alcohol substance misuse can have on our society. A lot of folks may be very familiar with the opioid epidemic. You've seen this in the news or you've learned about it in other contexts. This is from the National Vital Statistics System. That's actually from the mortality file. And this gives us sort of a visual picture of what the opioid crisis has looked like over the past few decades, starting way back here in 1999. I'm not sure how well you can see this, but you can see that these colored lines coincide with heroin, other commonly prescribed opioids, and then up above that you see other synthetic opioids and then any opioid. And these are deaths per 100,000 people. So back in 1999, per 100,000 people, we were looking at somewhere between 0 and 4. All right, but as time passes, we see a steady increase. And then once we get to 2009, 2010, we begin to see a significant rise in opioid-related deaths, specifically in relation to synthetic opioids. Those are things like tramadol, fentanyl. These can either be prescribed or they may be illicitly manufactured. And then also up there at the top is any opioid. So you can see that there has been a significant increase. And so there's been lots of lawsuits and a lot of legislation that has affected that. But in terms of understanding addiction, we really can't take this out of that context. And so we're not just talking about addictive behaviors, but we're talking about alcohol and other substances. And certainly at the top of mind right now is the opioid crisis. Let's talk briefly about some of the causes, right? People have been trying to explain why this happens since the existence of social problems, which goes back prior to recorded history. And so addictions are similar. There are lots of different explanations that have taken root over time. None of them have completely gone away. Everybody kind of has their own idea about why this happens, why it persists, and what can we do to stop it. One of those, agree or not, is this idea that addictions are some type of moral failing. This is a much older idea, but still very prevalent, depending on where you are in the United States and where you are in the world. Addictions can be seen by some folks as a moral failing. The flip side of that is disease, right? On the one hand, we've got this idea that addiction could be related to some type of character flaw or moral failing. And then the flip side of that is that we're dealing with something that is an observable, diagnosable disease. This is what we call the disease model. This is most prevalent in the United States. This is the model that informs diagnosis and treatment of addiction and substance-related disorders. And so definitely something to understand and know about. And then here in the middle, you see some of the more contextual explanations, right? Over here we see secondary symptoms of emotional pain and or mental health problems. And then over there, combination of some environmental, social, psychological, and even genetic variables. So understanding the causes of dependence and addiction is extremely complicated. It is far more difficult than we can really get into in this brief lunch and learn. But if it's something that you're interested in, there are plenty of books, and you're welcome to send a message, and I'm glad to help you out and point you in those directions. But lots of explanations over time. But primarily in the United States and in some other places, we're talking specifically about this disease model. Impact. I mentioned earlier that it's hard to look around, especially depending on where you live in the United States, but we're in the southeastern United States, and this is something that is really at top of mind. It's hard to look around and not see some of the impact of substance misuse and other addictive behaviors. Here you can see some of the examples of the physical impact that can occur. Related to alcohol, you can see reduced coordination, increased heart rate, dizziness, nausea, vomiting, pancreatitis, liver failure, and below that you can see listed some of the things that can happen with amphetamines, with nicotine. Some of the things people don't think about nicotine. We're right now in an interesting place where there's lots of different evidence out there about nicotine and how you take it and how much you take. But we know in general it can be associated with increased blood pressure, increased breath rate, heart rate, and even heart disease. But there are some conflicting opinions out there about nicotine. So the physical impact, it's not usually is the most accessible thing to us, right? It's easy to say this is going to harm your health. What about the psychological impact? Changes in brain structure. Okay, one of the things that we know is that we can observe changes in brain structure as a result of prolonged exposure to different substances. Behavioral problems, right? We see changes in behavior, changes in personality, increased risk of mental health challenges. One of the things that we sometimes say in the world of addictions is some people think about substances as the problem, but it might be more helpful to think about substances as the solution to a problem, right? Not a good solution, one that can be harmful in lots of ways, but a solution nonetheless. People are seeking out some way to cope with one or more problems that they're experiencing in their life. And so definitely an increased risk of mental health challenges. One of the things that people find is there may be some short-term relief, but in the long term, what we often see is increased risk and increased severity of mental health related issues. And then there's the entire world of diagnosable substance use disorders. Again, that's associated with the disease model. Depending on frequency, intensity, duration, then it could be that there is some type of diagnosable substance use disorder that indicates some very specific types of treatments. So definitely heavy psychological impact. And then the social impact. We'd be remiss if we didn't mention the social impact, right? Housing instability. These are just a few of the things that have been identified by multiple sources, the CDC, the Substance Abuse and Mental Health Services Association, as being related to the social impact of substance misuse. Housing instability, criminal behavior. Obviously, as we know, there's an entire range of criminal law that addresses substance behaviors, and the violation of those laws result in criminal charges. People can get caught up in the criminal justice system, and it has a very negative impact on not only individuals, but also the families that are caught up in that. And then also the general public safety issues, right? I mean, these are things that they're personal behaviors, but as we all know, they also have a social impact. Negative health outcomes, we've discussed that. Decreased satisfaction in personal relationships, isolation. One of the things that we know is a result of addiction is that it is a very isolating issue. People sometimes think that it may increase connection, but in fact we know that in the long term it does the opposite. It results in increased isolation. And when we talk about recovery, one of the things that we try to do is reconnect, reintegrate. Okay, so addressing these issues related to social isolation is important. We are a campus center, and so I would be remiss if we didn't mention the potential impact on academic performance. People that are using substances are more likely than the general student population to skip classes, more likely to have lower grades, more likely to leave school altogether, whether it's the result of academic probation or suspension, or whether this is a personal decision to leave the school setting. So significant social impact as well. One of the things that I always try to make sure and address when we're doing talks like these is what I sometimes consider sort of the often hidden damage of substance misuse, and that are issues related to codependency. Now, people that know about codependency and what it is, it can sometimes be an issue that can contribute to substance misuse, but it can also be caused by exposure, say in the family home, to substance misuse. What is it? Codependency is a broad term that's used to describe unhealthy behaviors that are learned in some type of system, right? A family system, a social system. And the hallmarks are excessive caregiving. Someone is engaging in excessive caregiving, suppression of their own needs in service of someone else's needs. It usually results in reduced feelings of self-worth and tends to show up in a long pattern of dysfunctional relationships. Okay, this is what a lot of people will commonly call enabling, right? This is a term that's often used to describe not just situations where someone's patterns of substance misuse are being maintained in some type of system, but it's also a term that's used to describe people, right? You've probably heard someone described as an enabler. It can be kind of a pejorative term, and it's a term that we use sometimes to try and intimidate people and make them feel badly about their behavior so that they will change it. What you're in fact seeing are codependent behaviors, right? This is a behavior that someone has learned in that system or in the family system that they came from. And what they're really doing, whether they realize it or not, is they're trying to maintain some kind of balance in their life when they've had a very difficult time maintaining that balance otherwise. One of the difficult things to understand when it comes to codependency is that the individual can recover, right? There's hope is the good news in the addictions, is that people can and do recover, and that's part of why our center exists. But one of the things that makes this such a hidden problem is the individual can recover, but codependent behaviors will persist. Sometimes the damage that is done to families will remain. And so one of the things that we try to do is understand codependency when it's happening and get people connected to some type of help, right? Whether it's a group that is specifically for families, think about Al-Anon, Alateen. There are self-help groups that are specifically out there to support the families and people in the social systems of the person who's trying to recover. There's also group therapy, self-help groups, and people can often benefit also from individual psychotherapy related to codependent behavior. So I wanted to highlight that as one impact. So that's kind of the quick version of addiction and its impact. Obviously, that's incredibly simplistic. We only have so much time in a talk like this to go over that. If it's something that you're interested in, I strongly encourage you. There are lots of resources out there. There are courses that you can take and professionals that you can talk to learn more about addiction and the impact of addictions. But let's shift, if we can, over to what are we trying to do about it? How are we trying to intervene? And there are various ways that we're trying to do that. One of those is through prevention, right? It might seem intuitive that the best way to address a problem is to stop the problem before it starts. And so we think a lot about prevention. We have an entire prevention arm at our center, and we'll talk about that in just a minute. Our prevention efforts from an evidence base are supported by this strategic prevention framework. It may be something that you've heard of before. This is a model that has been put in place by the Substance Abuse and Mental Health Services Administration, sometimes called SAMHSA. At any rate, it involves the process that you can see over here in this visual, right? Assessment of the situation, building capacity, right? Identify the problem, be able to put your finger on what it is that's happening, where it's happening, and then build capacity to address that problem. Engage community partners in the efforts, come up with a plan of action, a way to try and address very specific issues, implement that plan, and then evaluate that plan. Okay, so there is a framework, there is a prevention framework that is being used, and we learn about that. We've been to trainings at the center as to how to implement plans related to this strategic prevention framework. So we engage in a lot of prevention activities. We'll talk about those in a minute. We're also guided by these principles of recovery, also coming to us from the Substance Abuse and Mental Health Services Administration. When we're thinking about getting better, right? How do we recover? If this is happening, how can we identify it and how can we intervene? How can we wrap our arms around folks who are struggling with these issues and try and give them some guidance, support, and hope? And so that's at the top of SAMHSA's guiding principles of recovery. Recovery is driven by hope, right? Sometimes we say that change is a result of the push of discomfort and the pull of hope, right? So people are in a very uncomfortable place. We try to provide them with hope and give them motivation, help develop in them some motivation for the future. It's person-driven. We recognize that there are many pathways to recovery. It's one of our guiding principles in our recovery program at the center. And that is to say, people find recovery in a lot of different ways. And we respect all of those ways, right? Some people find recovery on their own. It does happen. Sometimes people realize that they're experiencing a problem, they recognize a need for transformation, and they're able to gather the resources and achieve that, sometimes without any outside help whatsoever. Other people find recovery in a faith-based situation. People find recovery in their church community. People find recovery in their faith. Sometimes people will come into recovery and follow a 12-step model, right? Alcoholics Anonymous, AA, something that everybody is probably familiar with. That's a 12-step based program. So a lot of people will find that as their pathway. And others take along a huge spectrum of pathways to recovery. One of the things that we want to do is recognize all of those pathways. If somebody recognizes a need for personal transformation, then in order to not only help the person, but also to help the group and global culture, then we want to recognize all of those pathways. It's holistic, it addresses all areas of life. It is rooted in peer support, the support of peers and allies. That's a big part of what we do at the center. It's relational, it is deeply rooted in culture. It addresses trauma, discrimination, and stigma. It's about strengths, not deficits, and it is about respect. Okay, so there's lots of information about this on the SAMHSA website, but when we talk about what guides, hopefully, policy and certainly our activities when it comes to recovery, these are the guiding principles. There are lots of different types of treatment out there in the community. What you see here are some primary types. If you're not familiar with the types of resources that exist to help folks who are struggling with addictions and seeking recovery, there are certainly a lot of faith-based resources, right? These are resources that are available through your church community. A lot of churches, especially larger churches, have a significant recovery community and recovery services as a part of their program. They're religious-based. They center on faith, providing spiritual guidance and community support. They look a lot of different ways. There's no way to paint all of the faith-based treatment options out there. Recovery options with one brush. There are many different versions of it, and for some people, that becomes their path to recovery. There are also clinical programs, right? We're talking about the disease model, and so if there is a diagnosis, whether it's a substance use disorder, as well as some type of co-occurring mental health disorder, then there are clinical treatment options out there, right? These typically take two forms. They look either like inpatient treatment or outpatient treatment, as they're commonly known. Inpatient treatment is exactly what it sounds like. This is when someone is admitted to stay in a clinical and institutional type situation. Length of stay can vary. It might be 21 days, it might be 28 days, maybe even longer, depending on health insurance and ability to pay and all that stuff. In these inpatient stays, people are often given opportunities for group therapy. There are lots of group situations. They might also receive some individual counseling as a part of their stay. There could be some medication-assisted detoxification. Someone could be prescribed other medications to try and assist with not only their transition off of the substance, but also to assist with their transition back into the community. And then there are outpatient programs. These are far more common. It's much more difficult to get into an inpatient treatment situation. Quite often people find themselves in these IOPs, right? Intensive outpatient programs. These are, as they sound, outpatient. No, the person is not staying in a clinical situation. They're typically attending multiple groups per week. There's a cap set on the number of people in each group. There is a trained facilitator facilitating those groups, and they usually last a significant amount of time. These IOPs often last 90 days or more. So somebody is attending a group multiple times per week, sometimes 3 or 4 times a week, and it lasts for 90 days. So those are inpatient and outpatient programs, and those are usually facilitated by community mental health providers. And so it's quite often that a community mental health center will also have an inpatient and maybe an outpatient and maybe even an inpatient program. Peer support. We're going to talk more about that. Peer support is what we are heavily involved in at the center. Peer support is not treatment. We'll talk about that. Peer support is peer support. It's mutual aid. It's not clinical in nature, and it's no substitute for clinical treatment if that's indicated. But there are various types of peer support out there, right? Alcoholics Anonymous is peer support, Narcotics Anonymous. There are various types of self-help peer support groups that are out there. We facilitate peer support groups at the center. So we'll talk more about that. There are some gaps, right? There are things that we don't have. Recovery programs are limited. They're limited in number. right? The Cookeville micropolitan area is largely rural, right? Once you get outside of Cookeville proper, as you all know, you're in some very rural areas, and you get into the outlying counties in the Upper Cumberland, and there may not be a significant treatment or recovery community in that area, so people have to travel. Quite often, people can be limited, especially in their clinical recovery, by access to the healthcare system. It's about health insurance, and so hopefully people have got health insurance that will help pay for these experiences, but they may not, and that can place a limit on what is available to people. And even with regard to peer support, right? We hope that there would be peer support available to people in all areas, but it gets more difficult the further out from the city center that you get, okay? So those are the various types of treatment resources that are out there. Let me talk a little bit about what we do, okay? So at the Center for Addiction Prevention and Support, this slide right here lists our mission, right? We're here to reduce and prevent substance misuse among students at Tennessee Tech University and among emerging adults in the community. So that's something that's important to understand about our center, and that is that we are not just here to serve emerging adults on campus, but we also have a community-facing piece. So we're also here to support emerging adults in the community. The important thing is that demographic, emerging adults. We're trying to provide a supportive community for people who are in that age range between 18 and 29 years of age. People are in similar developmental places. They're often in similar places in trying to find a career, trying to develop their identity. And so we're trying to define a demographic where people can really support each other and they don't feel excluded because of things like age or because they just don't feel connected to a group. So it's TTU students and the local community. And so let me tell you a little bit about kind of what we do. First is prevention. I'm going to ask Adrienne to stand up for just a second. Adrienne Lees is our prevention coordinator. She's a certified peer recovery specialist, and she has brought all sorts of things here that you can see and can tell us just a little bit about what prevention does.
So like Matt was saying, that one of the ways that we work at the Center of Addiction Prevention and Support is that we try to prevent addictions before they occur. So one of the ways that we do that is we provide a plethora of information, not only to our Tennessee Tech students, but to the community. We are available to do events like this all the time. We can come out and bring our prevention material, talk about the different ways that marijuana, alcohol, opioids affect the body and the way that you perform, either academically or in the workforce. And then we provide other prevention materials like this lockbox. We provide lockboxes to anyone in the community who asks for them. This is a great way to keep addictions from performing. If you are taking an addictive type medication and you want to keep it safe from the people in your family, the best way to do it is to keep it locked up. And that's how you keep addictions from happening to members in your family. We also just have different ways to keep yourself safe medication disposal type things that we pass out to anyone who asks for them in the community. We're always available to come out and speak about different ways to prevent addictions from happening. So that's what we do with the prevention side of addiction for Tennessee Tech students and the community. And I'll pass it back over to Matt.
Excellent, thank you, Adrienne. So you might be able to find, especially if you're on campus and also in the community, you might be able to find Adrienne. We have a team of prevention specialists through the university that help out. And then we've also got a student group. We've got a newly formed student group on campus that engages with us in our prevention efforts as well. So you might be able to find Adrienne and the prevention crew on campus or in the community handing out all of this good stuff and engaging in some fun activities. I've got I got a slide up here. Can you tell us kind of what's happening in these activities so that people can kind of see what we try to do on campus?
So this picture over here is Greek life. We try to target our Greek life a lot, just go in and talk about safe alcohol consumption, making sure that people really know what they're doing with their bodies when they're consuming these type things. This is a fun game that we play with all of our students, normally during week of welcome, stuff like that, when the weather's nice and we're out on the quad. It's guess the pour. A lot of people are heavy-handed pourers, so we like to just, hey, this is what a regular size shot looks like. This is what a standard beer looks like in the age of Stanley 40-ounce drink cups. It can be easy to consume alcohol, so we like to talk to people. not only on campus, but when you go out into the community, we do things like the Fall Fun Fest. You can find us talking about safe drink sizes there. This, we focused on marijuana. As you can see, or maybe you can't see, I'm not sure. This fella he's got these goggles that simulate what it would be like to smoke marijuana, and he's trying to do a puzzle. He struggled a little bit, it's kind of hard. The goggles don't really help you see that well. It kind of distorts your vision. It gives you that slow cognitive delay that smoking marijuana would cause, just simulated via goggles. But we always try to do fun activities because prevention can be a little boring. Nobody wants to be talked to about their bad habits. So we always try to just inform, give the good information. So that's what these pictures are doing. We're just playing some fun games to get the information out there about substance misuse.
Excellent, thank you, Adrian, I appreciate that. The second kind of arm of what we do is recovery. Okay, support. So I'm the support, Adrian is our prevention coordinator, I'm the support coordinator. This is Garrett Travis. Garrett is our support specialist. Garrett is working towards becoming a certified peer recovery specialist. Adrian, I think did I mention, Adrian is a certified peer recovery specialist, and in addition to working with prevention, she also helps facilitate, as does Garrett, our peer support groups. So let me talk a little bit about the Eagle Recovery community. And so this is the support arm of what we do at the center. We're a community of faculty and staff and students and community members who are all coming together to try and build a supportive community for students on campus who are in recovery from addictions or they're interested in recovery, and also young adults in the community. And so to that end, what we do is we facilitate peer support groups. Okay, so again, here we are at peer support. Peer support, as I'll mention, it's not treatment, it is mutual aid, right? It is people helping people. They get together, they have some shared experience, they're able to share stories, provide each other with guidance, provide each other with feedback, and engage in a range of activities they can engage in a range of activities with people they feel some mutuality with. And we know that this is very, very helpful. We've seen it work. Peer support has lots of evidence. And so what we try to do is facilitate peer support groups. And we've got a schedule. I'll show you that at the end. What does that include? It includes meetings, right? So we have regular peer support meetings that we facilitate both at the center, also on campus. We plan to have sober events, and so these, especially on campus, students want to take part in a lot of the sort of campus-wide events that are so important to the college experience. Think about football games, right? Think about tailgates, think about graduation, think about homecoming. There's so many types of activities that students want to engage in, but they may feel hesitant or worried to do so because they're afraid of how that might affect their recovery. And so one of the things that we are hoping to do more of is to have more sort of alternative sober events. You want to be of service, right? One of the things that we do in recovery is we try to always partner with prevention. And so we're trying to get involved with different activities and trying to help our folks be of service, and in doing so, reconnect. Remember a few slides back when I mentioned that recovery is really about isolation and separation. I mean, substance misuse is about isolation and separation. Recovery is about connection, right? One of the things that we say is we recover together. We don't recover alone. And so service is a big part of that, and then just general mutual aid. We're trying to build a community of peers and allies that are there to help each other in whatever way that might be, okay? Some of our values, these are reminiscent of the guiding principles of recovery, right? There are many pathways to recovery. We don't exclude people from our program because let's say they're taking part in this type of recovery or that type of recovery. We recognize that there are many pathways to recovery, and as long as someone is working towards that personal transformation and they are sober in our space and at all of our events, then we're going to accept them. We're going to be as inclusive as we possibly can. It's holistic. It's supported by both peers and allies. Sometimes people are concerned, well, I'm not in recovery. This is not a problem that I have ever experienced. Well, you can still get involved because, again, recovery is supported by peers, but also allies. Perhaps addiction has touched your life in some way. Perhaps you just feel called to be of service to that community. We will involve you. We have many ways that you can get involved and learn about addiction, kind of like what we're doing today, and then find ways to get involved. It involves addressing discrimination, shame, and stigma. Believe it or not, in general, there are problems with sort of discrimination even amongst people who are in recovery. The recovery communities can sometimes be very exclusive, depending on what your pathway to recovery is. One of the things that we're trying to do with our center is be as inclusive as we possibly can. We want to not only include everyone that we can to try and build that recovery community, we also want to actively work against discrimination and the shame and stigma that is associated with having had a substance use problem. Some of those things, especially those labels, can follow you as you try to recover and can restrict you from getting better. And so we always work towards addressing those issues, and overall it involves rejoining and building a life in the community. Okay, that's what our peer support community is all about. A few important things to understand about what we are not, right? This is very important. Number one, our peer support program is not treatment. All right, it is not clinical treatment like I talked about before. It's not individual or group psychotherapy. It is not inpatient or outpatient treatment, nor is it any substitute for any one of those things when it's needed. If somebody wants to come to our peer support groups and they're also taking part in some clinical treatment option, that is fine. But understand that our peer support programs are not treatment of any type. Unfortunately, we are a band of people working together to try and make this thing work. A lot of us are part-time. I'm also a lecturer at the university. Other folks that are working with us have other responsibilities, and so we're working very hard to keep this staffed and maintained, and we're doing a very good job of it. But what we can't be is any type of a crisis service. We just can't be on call 24 hours a day for folks who are taking part in our program. We are as available as we possibly can be, and of course, part of building that peer support community is building something that is always there for someone, but we as center staff can't be, we don't have a structure to respond to crises. And also, we're not a 12-step program. Quite often when people hear recovery, they hear Alcoholics Anonymous, they hear 12 steps, because that's what's most visible, right? We see it in television. It's the kind of thing that shows up in the court system. People are often referred to take part in 12-step programs, AA, NA. Those programs are fantastic. We are just not a 12-step based program. We recognize that the 12 steps are very important to people, and we support people on that journey, but we don't exclude people if that's not what they want, right? We just are not a 12-step based program. So that's just some information about what we're doing with peer support. Here's our spring schedule. If anybody wants to get hard copies of this, I'm glad to bring you all of the hard copies that you may need. I can also email you a PDF. And on that PDF, these links will work. We've got social media that Ms. Adrian and the prevention specialists and our student group work very hard to maintain. So we've got a Facebook presence, we have an Instagram presence, and then over there is a QR code. The PDF, all of those things will work. So we've got 2 peer support meetings per week. We have a Monday night meeting that takes place from 6 to 7. And then we have a Thursday meeting on campus that takes place between 11 and 12, what students will commonly know as dead hour. It's called dead hour because nothing else is happening there. That's when groups meet. That's when a lot of meetings happen. And so we've got a meeting there too. The Monday night group is at our center. And I'm aware that over the course of this presentation, I've done things like point here and there. That's because we're in the public library right now, and our center is almost next door to the public library. We are in the Regions building, and so all you have to do is sort of walk out the front door, walk up past the Performing Arts Center, and then we are on the 3rd floor of the Regions building. So we have this great downtown location, and we have our Monday night meetings there at the center. If you want to see the center, again, you can contact us. We'll be glad to show you around. Or you can come and see us at this event that we are having that's here on the other side. Mondays are at the center. Thursdays are on campus, Matthews Daniel Hall, room 321 if you're a student on campus, or if you are just on campus and want to come and meet with us. We've got that Thursday peer support meeting 11 to 12. And then we have this new initiative that Garrett is spearheading called ERC Connections. Okay, this is a Wednesday night social hangout event. We show movies, we're going to have games, there's all sorts of things that we're going to be doing. The center doors are open. It's staffed from 6 p.m. to 9 p.m. And if you want to learn more about what we're doing, you can get on our email list, which I encourage you to do to find out. But this is just an evening of social engagement, whether it is our peers from groups or whether it's allies, people that just want to come and connect with us, learn about what the center does, and just have a nice Wednesday night hangout. They're welcome to do that. So that's our spring schedule. We'll have other pop-up events. There are other things that will happen. So I encourage you to contact us via email and get on our list so that we can make you aware of those other fun things that we may be doing. Over here on the other side, on Thursday, February 6th, which is Thursday, right, this Thursday, we're having a Recovery Ally Night. We're very excited about this. As I mentioned, one of our initiatives is that recovery is supported by peers and allies. And to that end, we are providing an evening of networking and recovery ally training. And that's what this is all about, okay? The doors will open at 4 at the center, right? Just up the road, Regions Building. Doors will open at 4 for some networking and refreshments. We've got our student group is going to make mocktails. We'll have some other things, and so it'll be a chance to sort of meet us if you'd like to do that. Professionals who are working in the community will be able to network with each other. If you're clinical professionals, people that are working in community prevention, faculty and staff at the university can come and mingle about. There'll be some brief presentations by those of us here at the center talking a little bit about what we're doing. There'll be an opportunity for some of the community professionals to talk about what they're doing. But our centerpiece is the State's Recovery Ally Training. We're bringing in Samantha McIntyre, who is the Director of Collegiate Recovery for the Tennessee Alliance of Mental Health Organizations. We call it TAMHO. She is coming and is going to be providing this Recovery Ally Training, which is just a brief overview of sort of a crash course of what someone needs to know in order to be an effective ally to someone in their life or someone who they encounter who's struggling with substance use related issues, okay? So we're trying to get as many people involved and as many people trained as possible. So this is wide open, it is free. Please come, we'd love to see you at the center. If you'd like hard copies of that, I'm open to getting those to you. I can also email those things to you, okay? I think I already talked about all of those things. And that's it. You've got this big QR code up here. It would be great if you click that. It'll take you to a spot where it'll just ask you a couple of questions about how our presentation was, and also give you the opportunity to join our mailing list, which we very much want you to do. We want to get you information about what we're doing, okay, so that we can build this community, working towards prevention, working towards peer support and recovery. And then as a university center, there's always a research aspect. And so we are not only doing the work, we are also evaluating the work that we are doing. And so responding to QR codes and telling us how we're doing is important. Any questions?
My daughter is on the spectrum.
Okay.
And if you have a movie, she's not addicted, but those movies.
Okay.
And I was wondering if that kind of a guest would be welcome. I don't know how she would react. I don't know. She comes to movies here. We live near the college. She's 20.
Okay.
She's 20, and socially, it's tough.
I gotcha.
And I don't know, do you, another question would be, do you find that people on the spectrum are, have problems with addiction, or is it?
Okay, so two questions. One, you had mentioned that you've got someone in your life that you have concerns may be developing a behavioral.
I just was thinking she would be interested in the movie and maybe talk with, or is the movie educational,
Are you talking about the Wednesday nights?
the evening you have?
Oh, right. That evening is open to anyone. I mean, quite honestly, we want to engage people. We want people to see the center. And my answer to that would be, come and check it out.
See,
We might do educational films and documentaries, but we also just show fun movies, right? It's just an opportunity. We've got a popcorn maker up there. We just make popcorn, and so my suggestion there would be just to try it out. It's open.
cause she has great opinions.
Cool.
It's pretty cool, pretty cool.
And then your second question is,
So
are-
do you, I don't fear that, but do you see that much with people who are on the spectrum with autism, with addiction?
okay, so that anecdotally, just me myself, I couldn't say, because quite often I don't know,
You don't
right?
know?
I you know
You don't know? Okay.
I don't know if that's.
Well, I
That's
just
what's
wondered if
going
it was
on.
maybe something I should be thinking.
I think that
Worried.
anyone, any human, right, who's experiencing the various stresses and challenges of living life could potentially develop an addiction.
Okay.
That doesn't mean everybody does. It doesn't mean that any person is more likely to, right? I would really not want to say that anybody, especially with any clinical diagnosis, is more likely. Though, if there were a scientist in here, a physician, somebody that really had a grasp on that research, they may be able to give you a different answer, but I can't.
I find it fascinating that, like I attended one on autism,
Yeah.
and the things I found out in there were amazing, just amazing. So I was just wondering if you found that result with kids on the spectrum, but I appreciate you.
No problem. I wish I had a better answer for your question, but I do have an answer for should they come, for sure. Yeah, especially to Wednesday nights, and this may be, you may be want to just get involved and be an ally, right? I mean, you never know what could
Yes.
happen.
That might be something.
Yeah, great questions. I appreciate that.
Thank you.
Thank you,
I
Matt.
think that's it. Thanks everybody for watching, and please reach out to us if you want more information or you want to get involved.